muscles, right? So it's sort of like a backup for O2 store, like O2 usage. So, so obviously it would make sense that these have a very strong affinity for oxygen because you want to hold on to that, and then only in desperate need you will start to use this, right? What about the human fetal hemoglobin in comparison to human hemoglobin?
Relatively higher.
It's relatively higher, so it has a higher affinity for oxygen. Why do you think that is? What benefit would that serve?
I guess you could take the oxygen from the maternal blood into the fetus.
Yeah, exactly. So the fetus is developing. It is using it needs a lot of energy to develop and undergo its tissue specification and growth. So it would make sense that, okay, the mother is taking in its oxygen maybe a little bit more than usual, right? Because you see the maternal hemoglobin because it has a fetus inside, but then it also has to pass that oxygen onto the fetus. So the fetus has to have more affinity in order to develop. Good. So there are certain things that could affect the normal human hemoglobin curve. Does anybody remember what can affect that? Temperature and pH. So let's talk about pH. How do you think pH affects this curve? What does it do to the curve? Moves it to the right. So what does a shift to the right mean? What?
Higher pH moves to the left.
Higher pH moves to the left from the norm. Like you're not gonna, human hemoglobin isn't just miraculously have more affinity for oxygen. But if it's shifted to the right, it's obviously able to shift back at a higher pH to normal. So what happens at a low pH? What does it mean to shift to the right? A lower affinity for oxygen. Why would your body do this? What do you think is happening if you have a low pH?
The carbon dioxide is coming in because your muscles are really active, and so you need to release the oxygen to supply the muscles with oxygen.
Exactly. So your body is recognizing whether it's muscles, whether it's tissue, your body is undergoing a lot of metabolism and it's undergoing a lot of cellular respiration. So there's a lot of CO2 being produced, thus lowering the pH of your body. And your body senses this, and your body doesn't shift the curve to the right. What do you think shifts the curve to the right?
pH itself.
The pH. Well, what about the pH? What is pH? The H+. So the H+ has the ability to also, the acid also has the ability to bind hemoglobin. So if the acid is binding hemoglobin, what can't bind hemoglobin? Oxygen. And so that's why it takes a higher pressure to bind the oxygen.
Does the H+ bind with the oxygen itself at all? Like, does it kind of prevent the oxygen? It just seems like
No,
it's
it's
all in the same thing.
The hydrogen, the acid actually binds, it's actually the HCl, it binds to the actual hemoglobin, yeah. So your tissues need more oxygen. That low pH is telling you you're undergoing a lot of cellular respiration, your tissues need more oxygen. So your body is going to do what it can to have the ability to give off more oxygen to the tissues. Does that make sense? So how would temperature affect this? Sort of along the same lines. Well, right. During metabolism, what are you producing? What's being produced other than your energy? Heat, right? So an increase in temperature, it's sort of the same similar relationship that your body's undergoing a lot of metabolism. So you're going to want to drop off O2 as much as you can.
So this rise in temperature increased the enzymatic activity in the red blood cell. It can bring carbon dioxide.
Slide down, yeah. Okay, there's one other molecule that we talked about in lecture. Does anybody remember what it was? BPG. So where is BPG produced?
That's by far from glycolysis.
So, and that's part of the apply the concept, so keep this in mind. So we naturally produce BPG during glycolysis, and BPG has the ability to do what? Binds hemoglobin. Also, again, shifting the curve to the right. So, do you think fetal hemoglobin would have less affinity for BPG? Do you think yeah, right? It would have adapted a way to avoid binding BPG because it needs to bind as much oxygen as possible. It also naturally has a higher affinity for oxygen, so oxygen is going to bind more tightly. Okay. Something else to keep in mind. When we talk about saturation, where do you think the hemoglobin is most saturated? About 100%. At the lung, once it picks up all of its oxygen, right? And when it travels throughout the body, when it circulates throughout the body, each hemoglobin only drops off one oxygen. So the rest of it circulates at 75% saturation. And if you look at 75% saturation, what pressure is that at? 40 millimeters per mercury. So that goes back to the heart, goes back to the lung. So now what's the partial pressure difference? It's pretty big, right? Because the atmosphere is what? 760, and coming in it's 40. So just how you could visualize the partial pressure difference. Does that make sense? Does anybody have any questions? And of course, just to be like more detailed, when the pH shifts the curve, that's called the Bohr effect. It's in the book, but comprehensive. Okay, so let's go over this apply the concept. Can somebody read it? We're gonna like break it down, so I'll tell you when to stop at certain points. You don't have to let the people wait. Can somebody read it?
Transfer of O2 from maternal to fetal blood is facilitated by the higher affinity of fetal hemoglobin for O2 compared with that of maternal hemoglobin. South American llamas live at high altitude, and their hemoglobin has a higher affinity for oxygen than does the hemoglobin of other mammals that live at low altitude.
Okay, let's stop there. So, what do we know about high altitudes? There's less oxygen available. So, let's think about the advantages that the llama would have with having a higher affinity for oxygen. So what do we know about the partial pressure difference in the Fick equation? What do we know about that if there's lower partial pressure at high altitudes? It's smaller, right? So the rate of diffusion goes down. Does everybody understand that according to that equation? Good. So there's a benefit. At the llama's lung, it's able to bind oxygen more tightly. But then let's think about what else has to happen. Again, always think about exchange of the lung and the atmosphere and the tissue. If the llama's hemoglobin has a very high affinity for oxygen, what also had to be modified in the llama?
The surface area of the lung?
Well, no, we already went over the lung. So the only thing that's changing is the hemoglobin's affinity. So at the lung, it's picking up and holding on to that oxygen very tightly, despite the low partial pressure difference, or the smaller partial pressure difference. What's the second thing we have to think about?
Is like the tidal regulation for BPG or a pH inside of it or something?
We'll get there, but before we get to things that will affect the hemoglobin, let's just think about what needs to